All right, ready for another installment of Myth-Busting AMAs? So we're going to talk about peptides and hormones and why they might be important. So we've talked about peptides before, and I think a lot of people have heard about peptides. There's a lot out there in the media, on socials, and maybe you've seen it at the gym. But the reality is that peptides work like hormones, since hormones are peptides and long proteins. And so you have to be a little careful when you're going to use peptides to make sure you understand exactly how they're working, what body systems they're affecting, what body systems are going to be affected by the fact that you're using a peptide or trying to manipulate other hormones. So it's not just for people who are at the gym, not just for athletes, not just for recovery. They're a component of what we do in endocrinology. They're an aspect of what we might do medically to help you, to help your recovery, to help your treatments, to help with whatever endocrine conditions we're managing. So sometimes some peptides are medically approved by the FDA, like some of the incretin hormones we might use for weight loss or diabetes. And there are other peptides, like growth hormone, that we use for people who have chronic health conditions, or even, as I'm sure you've seen, in recovery and other athletes, or people who have perhaps short stature, they're trying to grow taller, they have a failure of their growth hormone. Those are all peptides. And so those are approved peptides by the FDA that are pretty routine. There's a lot of guidance and a lot of understanding about how they work and how you use them. And then there are other peptides like NAD and BPC and sermorelin or tesamorelin, which are peptides, and they work like hormones, but they're not quite FDA approved. They're used in research, or they're used off-label, underground, but they do work like a hormone. So it's important, if you're going to use them, that you use them with somebody who understands how hormones work and who understand exactly what you're measuring, to make sure that you're getting the benefits of the therapy that you're looking for and that you're not getting any harm.